Hey ladies, this is video 3 of 3 for our PCOS series where we're going to be talking all about some treatment options that you have. So if you missed video 1, which we went over signs and symptoms, and then video 2, we went over how to get properly diagnosed, after this video, make sure you go and check both of those out. So now you've got your diagnosis, what the heck do you do next? Treatment is going to vary depending on which branch of PCOS you have. So you may have noticed when we talked about diagnosis, there's a few different things that might be going on leading to your signs and symptoms. If you're dealing with insulin resistance as the root cause, we're really going to want to focus our attention there on improving your insulin sensitivity versus just decreasing your androgens and trying to balance your hormones, because we really do want to focus on the root cause. If your androgens are high, but not necessarily coming from the ovary and more so coming from your adrenal glands from DHEA, then we're going to need to focus more on adrenal support and stress management versus, again, just balancing your hormones or focusing on reducing your androgens overall. So depending on what branch you have, the basic main goals of PCOS treatment are going to be to improve your insulin sensitization, decrease your androgens if they're high, if they're an issue, or keep them low if they're not an issue yet, improve your ovulation, which therefore will improve your progesterone, and then balance your hormones overall, regulate your cycle if you're dealing with irregular cycles. Depending on what was found in your blood work, what we recommend for you might be different than what actually works well for your girlfriend. So it's always really important to consult your healthcare practitioner when you are starting any sort of new treatment. And again, this video is not meant to be medical advice by any means, but it's things that I've used in clinic that I've seen work and something you can bring up with your healthcare practitioner if you are curious if it might work for you. So here are the 4 things that I like to do in practice. There's tons of other options. There's tons of research when it comes to PCOS. So we always have a few different avenues that we can try, but these are the ones that I feel like I have the most success with and that people feel generally better doing. So the first one is going to be diet, of course. So I like to get women with PCOS to gear more towards a Mediterranean style diet. So what that looks like is more good quality fats and proteins, less carbohydrates, but not no carbohydrates. I don't like to take people down into a keto level, but I do want you to focus on your carbohydrates coming more from veggies, starchy veggies, things like that, versus all grains, and maybe only 1 to 2 servings of good quality whole grains a day. Low glycemic fruits, lots of veggies, and then shifting more towards a lower sugar, low alcohol, low dairy diet to help reduce inflammation. And high sugar diets and high carb diets are really going to impact your insulin sensitivity. So those are the 2 big things we need to focus on when it comes to diet. Working with a nutritionist is often super beneficial for my patients. So I'll usually lay out the groundwork of what their diet wants to look like, and then I will actually get them to work with our registered holistic nutritionist in office for more accountability, more guided support, which can be really helpful if you're completely overhauling your entire diet. And the other thing you might hear about for PCOS is actually intermittent fasting. So what that does is it essentially gives your body a longer window to deal with the glucose from the day before. In our busy society, we tend to, eat dinner really late, get up and eat breakfast really early. We're not really giving our body a lot of time to reset. So intermittent fasting can be really crucial there when it comes to people with insulin resistance. But again, it's not for everybody. So it's something that I really want you guys to ask your healthcare practitioner about and do some research for sure. The second one is exercise. So exercise has actually been shown to increase your cells' receptivity to insulin. So moderate level of exercise, 20 to 30 minutes, about 3 times a week. You don't have to go crazy, can actually improve your insulin resistance. So this is something without supplements. This is so easy to do, and you're going to be getting so many other health benefits from it versus just treating your PCOS. So exercise is really important. I like to recommend things like yoga and Pilates, walking, resistance training. If you're struggling with adrenal issues or low or high cortisol that you know of, if you get really tired after a high intensity workout, this might be something for you. High intensity exercise may not be the right thing right now to actually balance your hormones. It might make things worse. So always good to consult with a professional when starting an exercise routine. Third is myo-inositol. So you may have, if you've been following along, this is a supplement I really like to use with my women with PCOS, especially if they're trying to conceive, but definitely if you have insulin resistance, inositol is going to be a good thing to have in your cupboard. It can improve cell communication, improve your insulin sensitivity, get you ovulating, reduce your testosterone, balance your hormones overall. You can get it in a powder, mix it in water. It's really yummy. It's a great thing to have. The last thing that I use quite often is actually something called saw palmetto, which is a herbal product. If you have high androgen, so testosterone, then saw palmetto can actually decrease your 5-alpha reductase enzyme and reduce the amount of testosterone that's being metabolized from DHT, or from testosterone, to DHT, which is a more potent androgen and often causing more of the issues than just having high testosterone in itself. So this is another good one that I find can work really well if you're dealing with the acne and the hair growth and the hair loss on the head side of things that testosterone tends to do. These are just 4 of the strategies I use in practice. So everyone's protocol tends to look a little bit different depending on what they're dealing with. But if you've been dealing with PCOS since you were a teen, or if you know you've had hormonal imbalance, but you haven't gotten any answers and all of this sounds really intriguing to you, then I greatly encourage you to reach out, get some help. DM me if you don't know who to go to, if you're not local, or if you're not sure what to do. I'll always be glad to help you, point you in the right direction. Because oftentimes what I'm finding is women, especially younger women with these signs and symptoms, are heading to their doctor's office and they're just getting the birth control pill to help regulate their cycles and help give them a monthly bleed. But at the end of the day, this isn't a cure for your PCOS. This is not balancing your hormones, and we're going to have to deal with it down the road, either when you want to start a family or when you're ready to come off the pill. So it's really important to just deal with it now. Let's just figure out what's going on. Let's balance your hormones. Let's get things under control and go from there. Remember, if you found this video helpful, please give it some love below. Give it a like, leave me a heart in the comments. I'd be happy to chat if you have any questions. If you missed the first 2 videos, go back and give those a look. You can find them on my IGTV. You can also find them on my YouTube channel, Dr. Kelsey Duncan ND. And if you'd like more information about PCOS, there's tons of good stuff up on the NCMC blog, www.naturalchoicemedicalclinic.com. You can also find that link in my profile bio. There's all of the videos I went over, all made into blogs, all up there. Plus there's other things about ovulation, some support with supplements, other treatment options, lots of goodies in there for you. So you can go on to the blog and search for tips there. If you have any questions, let me know, and I hope everyone has a really great week.